Hi, this is Dr. Nick. I'm the incrementalist. I'm delighted to be here after Dr. Marty Makary's talk this morning at the World Healthcare Congress, talking about the price and the challenges in the healthcare system. Marty, just briefly for the listeners, explain what you were talking about and the challenge of this pricing mechanism and what you see as the solutions to the way that we can fix this broken healthcare system.
Well, as you know, Nick, there's no silver bullet to healthcare, but if we had to summarize two of the main issues in healthcare, I would say it's the appropriateness of care,
right,
and it's pricing failures. It's doing too much medical care or sometimes undertreatment, too little care when it's needed. It's that appropriateness threshold, and it's also the fact that people deserve a price when it's a shoppable service. Now, if somebody gets shot in the heart, we're not going to give you a price, we're going to take care of you. But 60% of healthcare is entirely shoppable. That is, we can provide a price, it's just that we haven't done so because it hasn't really been required of us by the market. There hasn't been the demand. Instead, we've done these global discounts. We collectively, as a healthcare community, have functioned by global discounts to insurers. Patients are now paying a large stake in the bill, and they're getting hammered, and they want some transparency. They want to know what is a fair and reasonable price and what's the best price you can give me. Now, I can tell you, people are willing to pay more for quality, but they want honesty in pricing.
So one of the things you talked about in your presentation was the level of interest and focus now from a political standpoint, and I think what I heard you say was this is going to be the primary issue for the upcoming elections. Do you think that that's the case, and what's that going to do? How's that going to drive change?
Look, I've talked to hundreds of people who have been patients and are now struggling with a medical bill as a part of this national tour for the book, The Price We Pay. I visited 22 cities and talking to people on the ground, at the hospital level, insurance level, pharma level, you name it. Overwhelmingly, the voice I heard is that patients are getting hammered right now. They're getting hammered with bills they can't afford, that are overpriced, they're marked up, they're surprise bills, they're out of network care delivered at in-network facilities. People are mad. Right. And I think they have a right to be mad.
Look, I'm mad too.
Look, as a physician, you know that medicine is a beautiful art, and we have an incredible profession. The heritage of the medical profession is beautiful. But that public trust, which has been sacred, is now being eroded by predatory pricing and inappropriate care in the marketplace. And I think we need to speak out about it, and I think we need to, the centers that are doing the right thing and are billing fairly, which, by the way, is most of the centers out there. They're doing the right thing, or they're trying to. They need to broadcast that, and we need to create a market that rewards that good behavior.
So I just want to call you out specifically. You mentioned something really interesting to me that I think we need more Marty Makarys, because what you said was anytime you were involved where patients were being overbilled, essentially balance billing, all of those practices, as soon as you got involved, the cases were canceled, right?
Well, what's that tell you? When a hospital drops a bill because they see that I'm getting involved now and advocating for the patient, or I call the CEO and say, hey, the patient got overcharged, and you would happily accept a fifth of this money from Medicare. So why are you going after the low-income people? It used to be that the people paying out of pocket were uninsured, and the medical establishment, blamed them and said, how dare you not have insurance? It's now everybody. Everybody is getting hit with high deductibles.
Yep.
And so let's stop blaming the patient. The people I've been defending in court with these medical bills where the hospital goes after their wages and puts liens on their homes, these are working people.
Right.
They don't qualify for public funding. They don't qualify for Medicaid. They make too much money, $22,000, $28,000.
Too much money. Think about that.
Yeah, ironic. And they have insurance. So what did they do wrong?
Right.
They are working hard. They're single moms. These are, people who work for a living. I don't even think I work. I mean, I love what I do. I wouldn't even call it work. The person who's, going in and struggling and making it paycheck to paycheck, that's a very different life than what many of us in the medical world
experience
connect with. And I have been struck in doing the work for the price we pay. People are getting crushed out there.
So it just remains for me to thank you for being the advocate, for fighting for those patients. For those of you listening, The Price We Pay, important book. There's a new version of that coming out. Marty, thanks for joining me today.
Great, thanks. Good to be with you, Nick.
I'm Dr. Nick, I'm the Incrementalist, and I'm here at World Healthcare Congress with Dr. Marty Makary.